Well, guys, I'm so glad you all are here. We'll get this party started. My name's Kris Chan. I'm the founder of ActivAge, and for all those that are new to the Adult Day Pro webinar, thank you for joining us today. For everyone that's returning, thank you for being here. I appreciate your support. Love the little community of Adult Day dreamers and doers and entrepreneurs that we've curated here. It's amazing. Just a few housekeeping items for everyone is if you haven't been on this call before, we typically will spend the first 10 minutes doing some brief introductions. So you'll say your name, where you're from, and maybe what stage of this journey you're in. So hey, if you know someone or someone else on this call is in the same state, it's a great way for you to connect with others. After that, we'll dive into Q&A. And we'll try to go through as many questions as we possibly can. We typically will allow for 5 to 7 minutes per question, and the order in which we'll answer questions or dive into some of those questions that you guys might have is based on the order that they're in the chat box. So if you have specific questions that you're coming onto this call with, make sure you actually write them out in the chat box, even if you already wrote them out. Maybe when you filled out the form online, if things have changed or you have more clarity on your question, make sure you enter it into the chat, because we'll pull from the order in which they get submitted in the chat box. So that being said, we'll spend the next few minutes here real quick. Probably maybe only have time for maybe 5 or 7 minutes, but if you want to go ahead and feel free to unmute yourself, introduce yourself. So remember, this is just the quick little intros. So your name, where you're from, city and state, and then what stage of the journey you're in. So maybe you're exploring, kind of discovering, doing some research, or maybe you're, partially through construction, or just received your license, or are in the early stages of being open. Just kind of, share with us some insight as to maybe that stage of the journey that you're in. So that being said, guys, whoever wants to start, feel free to introduce yourselves.
I'll start. Hi, Kris.
Hello, how are you, Nancy?
I'm fine. I'm in Massachusetts, and my name is Nancy Omler, and I am in Massachusetts. So I've been in the journey for over about a year right now, and then I am in the process of getting everything ready before I can start doing the renovation. I need to find out from the DPH. I have my question right there. If I need to have a certain amount of money for my working capital before they come for the survey, because I need to do the renovation, and then I need to have, if I need to have some money, I need to
Well,
probably work on that. Yeah. So
look at that, guys. So she's already got her question loaded up in the chat box. So for
exactly.
everyone else on this call, if you haven't put your question in the chat box yet, do it now. Get it in there. So we have. It's funny because every single time, without fail, this always happens. Is we get into the intro section. I only have 1 or 2 questions to answer, and then all of a sudden the chat box just gets loaded up, and then we never get to everyone. So if you have that burning question now, do it now. Enter your question now. But Nancy, glad you're here. If someone else wants to introduce themselves.
Hi, Kris. This is Mary McClellan.
Hey, Mary.
Hey, how are you?
Doing good. How are you?
I'm great. I'm calling from Columbia, South Carolina. And thanks to you, we just celebrated 2 years of having opened. We're doing quite well.
All right.
But I still like to come on each month and just hear all the questions, because I never learn too much, never know too much. So it is 3 generations: myself, my daughter, and my granddaughter.
Oh my gosh, what a cool,
Thank you.
what an awesome experience that must be.
Yeah, the
Working together like
legacy.
that. Yeah, I love it. I love it. So Mary, real quick, just tell us, like, so 2 years now. Because I remember, like, it's hard to even believe that it's been that long. But I remember you were going through some fire sprinkler, questions way back when, and kind of got through all those hurdles and stuff like that. But so tell us maybe, briefly, like what's the 2-year journey been like for you? Maybe what are some things that you have learned that you could share with everyone else?
So much. We've learned so much. In fact, we just completed a 2-year we just redid, I guess, to update our what it's the policies on admission, attendance, and payment. We
Okay.
have learned so much just by doing it. So we
Yeah,
have just gone back and revamped to accommodate the needs of our clients and our needs. And it's going over very well. We happen to have wonderful caregivers and excellent patient clients. So that's one of the things that we just did. We just redid our policies and procedures as well, because it's a real learning process.
for
And
sure.
I was an educator, a retired educator before coming into this, but this is my legacy to my children. So I brought in all of my skills as an educator. So I do that. And then my daughter, who is a gerontologist, does that part with the programming. And then the granddaughter, who has a business degree, does the business portion of it with the billing and all of that, you know?
Love it. Love it.
Yeah.
So Mary, just as a reminder, to everyone too, like, so how many licensed, what are you licensed for capacity wise, members wise?
40.
40. Okay. And how many do you know offhand how many people you have in your total active census, or like your total census?
We have about 40, but not everyone comes every
Comes every day.
day.
Yeah. Yep.
Yeah,
Yep.
some come. We have some who come 5 days a week. We have
Yep.
some who come Monday, Wednesday, Friday. Then other families may Monday through Thursday. So it's a combination, you know. So
Now
we
in
don't
year two, how's the growth been the last 2 years for you?
come and
Like,
go.
yeah, are you seeing a little bit more consistency and kind of inquiries now? I mean, like now that you're 2 years in,
Yes, so we have the website, Facebook page. I've had a billboard sign for about a year now, and so like example today, the young man was in to test the fire system. He says, "Do you have a sign on the highway?" And I said,
yeah,
"Yes."
yeah,
He says, "I saw it," and I said, "I think I'm going there." So we get a
I love it.
lot of people who see the sign and they call, and thanks to you, we're very pleased. We
Well,
are very pleased.
I'm so grateful to hear, Mary. And and it's amazing that just to have been along this journey with you and to see you guys doing what you're doing now is fantastic. And for others in here, I mean, I met Mary on one of these calls, two years ago. I guess it's hard to believe that it's been that long, but she hadn't even opened yet, and I know they were going through the construction phase, and then had some fire, I think sprinkler roadblocks, got past that, got open, kind of went through the first initial, like one of the things that is very common in the adult day space is like we feel like, hey, if we build this, because we're investing money, time, energy, resources, usually over an extended period of time, and we hope, the intention is we open our doors and the floodgates open, and everyone just shows up, and it's and
It
it's and
happened.
it didn't doesn't quite happen like that. And Mary's not the only one. This is a very common problem amongst adult day, and it's something that, like, with these calls, hopefully we can help people through that period of time. But what's cool is to see Mary having gone through all that, and now having 40 people on her census, probably having served even maybe double that over the course of a 2-year period.
Yes.
Um, which is, you think about all the families and the lives that you've touched. It's amazing. So Mary, thank you for being here. Thanks for being part of this journey. Love following along and all that good stuff. I think for the sake of time, so
Thank
we
you.
we can jump into Q&A. Maybe
Thank you
we'll
so
do.
much.
Hey, thank you, Mary. It's funny, I don't know where, I don't know what city she moved to, but our nurse, who was our nurse here in our Sarasota location, she actually is moving up to South Carolina. Her last day was last Friday, so I have to find out what part of South Carolina. I know she told me, but I forget now. But I have to find out what part of South Carolina she's in. Maybe she can stop by and see you
That would be
one of these days.
wonderful.
I
Thank
love it.
you.
I
Thanks
love
so
it.
much.
So we got maybe time for maybe one more introduction. So we got Massachusetts in the house. We got South Carolina. Is anyone else on the call want to just introduce themselves, and then we'll jump into Q&A. So
Hi, I'm Larice. I am from Milwaukee, Wisconsin, and I own Resilient Hearts Adult Day Center.
Love it.
And the vendor actually sent me this because he works closely with us, and I'm hopping on just to get some information about how the upcoming process is going or is
And
supposed to go.
it's Larice, you said?
Larice, correct.
Larice, all right, awesome. So, typically, since you're new to this call, if you have any questions, that are specific to your location, definitely enter them into our chat. And as we go through the rest of this call, we'll answer everyone's questions in the order that they get input there. So this is kind of like last call for questions. If anyone has some, definitely put them in there now. And it sounds like Larice is already up and running or getting there. Are you? How long have you been open for, Larice?
We got licensed and now we're going through the contracting phase. We've been licensed since July 9th.
Okay.
So we've had 2 clients in there, and then the clients, because we did not have enough clients and they didn't want their clients in there by themselves, their loved ones in there by themselves. Now we don't have those 2 clients. So it's
Right.
kind of been an up and down roller coaster for us right now.
Now, are you Medicaid focused? Is that the contracting you're talking about going through right now? Is to
Um,
apply for Medicaid?
yes, correct.
Okay, got it. Yep. So see, sometimes guys, like, when you're opening an adult day center, whether you're a Medicaid focused adult day center versus a private pay focused adult day center, it could, there's some variables that can kind of come your way. So if you are Medicaid focused and you go through leasing a space and then go through licensing, and then, once you get your license, now you have to go through contracting or credentialing, or, depending on your state, it's going to be a little different. So there could be another potential delay from opening day to the day that you can actually start, receiving Medicaid clients. And so these are all, just little variables, and it really depends on your specific type of center that you're opening. But always great things to kind of dive deeper on. So that being said, guys, we got South Carolina, you said Wisconsin, I think, Larice, right? And then
Yes, correct.
Massachusetts in the house. So we'll go ahead and jump into the questions. Nancy, I know you're up first. So let's dive into your question a little bit more. I know you kind of alluded to it a little bit in the intro, but
Yeah.
feel free to kind of, maybe break it down a little bit more. Try to summarize, your points as concisely as you can, and then we'll try to get back into answering that question for you.
Yeah, just before I ask the question, I know you're going to the NETSA conference.
Yep.
I tried after I registered, I thought everything was included, and then they said your part, your presentation is not included, so it's like a separate fee for that. And then I
Yes.
tried to
So there's
register again, I can't.
Yes, I mean, there should be an email somewhere on that registration page. And I believe Lance is either Lance, or there's going to be like another person that's kind of involved in helping to answer questions and facilitate, some of the support for the conference. So if you go to that page, you should find an email somewhere on there that you could email to them. And, there's like about 4 or 5 people that are part of NADSA on the administrative side that, one of them will certainly be able to help you out with that. And just for clarification purposes, for anyone that has never been to a NADSA conference, typically there's like the main conference, and then they have like what they call pre-conference um, uh, uh, seminars or educational things. So sometimes, like the day before the official conference starts, there might be classes in the morning and in the afternoon, as well as site visits, where you could have the opportunity to go visit a adult day centers in that area. And some of those pre-conference stuff are kind of a la carte. So you choose which one you want to go to, and you kind of pay a separate fee for that. And then the main conference, typically, I have to go back and look, but in most cases, sometimes there's like a fee for this day or that day or the whole conference, but
Yeah,
it's
they do
just for
have
the
it. Yeah,
yeah, yeah. So
for the whole
it's
conference all the days.
yeah, so there's a whole conference, individual days, and pre-conference stuff. So just as you're going through it, there should be kind of a little list of, the breakdown of different costs and what it includes. But I know for those that have never gone to it before, it might be a little bit, more confusing. So, great insight there, Nancy, to at least share with others if they do plan to attend, because that is something that I know can be a little confusing if you've never been to it before.
Yeah, it is confusing a little bit. I thought everything was included, and then I paid the amount, and then after.
Well, hey, Nancy, just know I'm not on the board. I don't make those decisions.
No,
I'm
no,
just a
it's
speaker.
okay. It's okay.
So,
I just wanted to
but
share that.
I agree with you. I've often suggested, I said, look, just make it all one price, you know, and because
Yeah,
of,
you
you know,
need to
it's like
tell them.
I try. I know. Trust me. It's they're a little old school, you know. But yeah, go ahead, Nancy. Feel free to dive into your questions so we can
Okay,
get through a few others.
my question, I have two questions, but they are simple. Um, I have to, they told me to, DPH told me when I'm ready to call them for the survey, the first survey. And then, as I told you the last time, last month, I need the money from the loan officer to do the renovation. And but the loan officer told me that they need the license to loan me the money. And then I explained that to them that I need I think you are the one who um advised me to ask for a conditional loan so that they can give me the money so I do the renovation, and after the renovation they can release the remaining of the money. So, but they told me one thing: the DPH sometimes require a working capital before the first survey. So I'd like to know if it's true. And the second question is,
And DPH told you that, or someone else told you that?
no, no, not DPH. The loan officer told me. So they said if they don't give me the license because I don't have the working capital, did they ask me to have a working capital? I said no, they didn't tell me anything like that. They just tell me to get everything ready. So when I'm ready to call them, and then they will come for
Yeah.
the
So,
survey.
you know, again, every state's going to be a little bit different, but like to give you an example, in Florida, you know, before we have the state of Florida come out in our state, the governing body for adult day services that provides a license is called ACA, or the Agency for Healthcare Administration. So what essentially when we apply for our license, you know, we have to our building has to be basically like ready to open. So like construction's done, all of our policies and procedures are in place. Everything is ready to go as if we're ready for opening day. Activities, you know, supplies are in, and you know everything's you know ready to roll. You know, like as if we were going to open the next day. And as part of that application for applying for licensure in the state of Florida, they have something called the Proof of Financial Ability, or a PFA.
Mhm.
Every state's going to be different, whether they have something that is similar, but maybe it's called something else, or whether you know you know they may or may not require that. I don't know each state's regulations, but in the state of Florida, and I would say best practices, it is common for a state to require something like that. In our state of Florida, it's a standard Excel worksheet that they have on their website that you know you have to have completed, and you submit that with your licensing application. And that proof of financial ability is you know basically kind of you know helping the state understand you know where everything is at financially, and kind of making sure that you know that you're not going to open on day one and then not be able to serve you know members appropriately. And so that is a requirement for the state of Florida, and it's certainly going to be a requirement for other states. Which states those are and what that form looks like is going to be a little bit different. And I know that is the proof of financial ability form for the state of Florida typically is something that actually will hold up a license if it's not completed correctly. And so in our state here, we have organizations, accounting firms who actually specialize in completing and filling out the proof of financial ability correctly, so that when it is submitted, it reduces the chances of the application getting held up, you know, at the state level because there was an error on it.
Okay. So that means you need to have the amount required in your account before you start, right?
Yeah, so typically when we fill out a proof of financial ability form, and we submit that with our license. And I would call DPH in your state and kind of ask them, hey, do you guys require a proof of financial ability or a proof of funds, in order for you to come out and do the survey. Just get clarification on what that form is. Is it a standard form that they have you fill out, or is it just certain requirements that they want you to send in, and it's up to your interpretation to send in what they're asking for? But in most cases, like here in Florida, we'll send in the Excel spreadsheet file, which is their proof of, their PFA form, and then we'll have to also send in proof of funds, and they used to just do like a bank statement with, or basically just like you pull off your monthly bank statement and the cover sheet. They used to just accept that and it was okay. Now in the state of Florida, last time that we submitted ours, I think they actually they required us to have the bank themselves write on letterhead that the funds were available in the account for that use.
Oh, okay. Okay. So in light of that idea, so I wonder if like starting with 10 patients, if I can have 10 patients, is it is it worth it? I don't know. Is it something that, because they require so many things to hire a lot of people, either hiring or maybe contracting with them. So I wonder if 10 patients would make the the budget to do all things.
Yeah, it just depends on like with 10 people, what are you charging? Is it private pay? Is it Medicaid? What's your lease costs? Do you have any debt? What's the cost of the debt? It would depend on so many factors. So 10 people per day is not a lot. But if you had a very small space and it was like you and one other person, it certainly could be doable, but it's, there's not going to be a whole lot of, uh, uh, margin there to
Mhm.
play with. I mean, so, everyone, it might be you and one other person or two other people, everyone's wearing multiple hats and you have a small space, but um, like at the end of the day, it's really going to depend on, what your costs are and, what your lease terms are. And if you have funding, and if it is debt, what are those debt payments,
Mhm. Yeah.
A
I,
general rule of thumb for us when we are, we're obviously, private pay focused. And so we are expecting, a minimum of at least $100 per day per person. And so if you were open say 5 days a week, just, for context, and you had say 10 people a day and you were going and you were able to, charge them $100 per person, you would
including
basically,
the transportation or no?
um, well, I mean, transportation would be, if transportation would be hard to, run it if you only had 10 people a day, like meaning the cost of, you know, adding transportation potentially might be prohibitive, Um, so I mean, you could add transportation, but if you added it, it might be like, you or that other person that's involved that's helping you out. Maybe you guys, are kind of sharing the responsibility of transportation, to help out. And so if you were to do that, you might charge a little extra, for that service to and from their home. You could charge a flat rate or something like that. But it's going to basically just cover the cost of your transportation, not necessarily be a revenue generator. So anytime we think about transportation, we know that if we were to take, the amount of money we're receiving, from people who are using transportation and what it costs to run transportation, it's kind of a loss leader. Like we are losing a little bit of money on every trip. We make up for it because the members who come on transportation may not come otherwise. So, it's one of those things that they, because we have it now they're actually coming and attending. If we didn't have it, they may not be a member here. And so we look at it like as we kind of lose money on transportation, but we make up for it because we have a greater attendance.
Okay.
Now, if you had just 10 at $100 a day, just to kind of, for easy math sake, it might be about a $220,000 to $250,000 a year, organization. If you had 10 people there every single day and they were all paying $100 each, so then you would kind of have to back out of that 200 to 250, per year. What are my expenses? And then does it still make sense?
Mm, that's hard. It
Yeah,
is
just
hard. Yeah. So
yeah,
it's it's a lot of expenses for the renovation. They I will probably loan some money to start, because what I have is not enough to make all of the expenses, and then one the on the first day. But
remind me of the size of your space or this.
it's gonna be like 1,000 square feet, but not all of them are part of the program. Because what they
Right.
require for the program, like the activity room, the kitchenette, the things like that, it's like about maybe 700 square feet. So it's not that much, you know.
Right.
I have an
Yeah. So
activity room of 400 square feet plus resting area, and the kitchenette. They consider all that like
yeah.
the patient area.
Well, I think the biggest thing for you to do is really go take that 200 to $250,000 number, break it into a monthly number. So you're looking at probably 16 to 20,000 a month. And so, take that 16 to $20,000 a month and figure out what are my other monthly expenses that are going to go into that, and then kind of see, like, at the end of the month, what am I left over with once I pay my debt service, once I pay, whatever other expenses, that are specific to your location, or, whatever costs you have to get it up off the ground. And you can use that as a reference for, like, okay, maybe you only netting 50 grand a year. Okay, well, if that is the case, then is all this effort worth it? Or maybe you look at it like, hey, this is a stepping stone, that I may not make a lot of money on this particular location, but it's a stepping stone to allow me to build, a client base, that then I can maybe move into a bigger space and then serve 20 to 30 people.
Mm-hmm. Yeah, that's
So,
true. That's true.
well, me,
Beginning would
you
be
know,
very, very, very difficult. Yeah.
For sure. Yeah. Well, it's a great question. I think just, kind of getting a better understanding of, like, what does my monthly budget look like, or my, not even budget, because, really, what are my minimum or maximum monthly expenses I should expect for my space, and then kind of, take that top line and those expenses and see, like, what's left over to see, if you can still make it all work.
I even thinking about, like, if I need to take all this loan from them. It's $150,000. I don't know if I will be able to to
My
pay
my my
that
my
down.
my my favorite person who bootstrapped it, and started with nothing, is Alicia Kleinhardt. She's in Kankakee, Illinois. And you can find her on Facebook. I believe it's MCA, Adult Day Center. And it's, she's a testimony and true testimony of, bootstrapping it. And she started the nonprofit and got things donated to her and pulled it all together, and has been able to kind of, pull this thing, and get it off the ground without having to go, take on 150, $200,000 worth of debt. So, like, she's a great example of, doing it without having to, raise money, or, um, go into debt to make it happen. But there's definitely a lot of upfront expense, for anyone that's just getting started, because, you're going to have leasing costs of, having a space. You're going to have renovation costs. You're going to have your startup costs of getting it open. And so you have all these costs that are going into it for, 9 months to 18 months before you ever start, receiving any sort of revenue. And so that can be a difficult time to weather unless you are, you've figured out how to plan financially, whether it's through raising money or, and going the nonprofit route or, taking on debt, and so, it'll be important, to pick one way or the other. Like I got to either go for profit, get a partner, bring on an equity partner, go raise debt, or maybe I go nonprofit and I try to, fundraise for it, or maybe I bootstrap it and try to see if I can get a space that's free, or maybe work on some sort of partnership with a church or whatever the case might be. So I think it's a great question, Nancy, and I think there's a lot of things that were helpful to others because of your question. So I appreciate that. I'm going to go on to the next person so we can get a few more people in here too. But I appreciate you being on this call.
Thank you. Thank you very much.
All right, I think Jessica. Jessica, are you still on?
Yes, hi. I'm from New York City and just joining for the first time, although I am loving all of your recordings. So thank you for making all that available to us.
Absolutely.
I was wondering if it matters to be minority and women-owned enterprise. Does that play into this business at all?
I think, from a grants perspective or from maybe, like a nonprofit fundraising perspective, there's certainly a lot of opportunities there. I think there's always like benefits, to, to being able to like, access funds, like say through a grant or through a nonprofit, or, there might be other, opportunities in your area that, organizations might do things, for minority or women-owned businesses. Maybe even when it comes to say free press or PR. I know like in our market, there's magazines and newspapers that like might have women-owned sections for businesses, and they can highlight different people, and that's always great. So there's certainly certain things that can help out with that for sure. When it comes to like contracts, like with the state,
Yeah.
Or Medicaid funding, I don't know enough about New York City to know if that's a possibility or not. We're primarily private pay focused. We do contract with the VA. We do have contracts with Medicaid, so we're familiar with it. But through that process, there was never an opportunity where I felt like, being women owned or, a minority, like had an effect on our ability to get through credentialing. For the credentialing and application process on state funded programs, like Medicaid or VA, seem to be very, kind of specifically focused on, are you licensed? Are you insured? Do you have the appropriate, just policies and procedures? And then they come and do a site visit, making sure everything's legit. And so it was really more heavily focused on the business itself, not so much me as the owner. But
Gotcha. Okay, thank you for that. And just so that I get a sense of how much time it takes, because I know I do appreciate the planning ahead and making sure things, any good things take time. So yes, but I'm wondering, how long does it take for Medicaid to that process to happen? And also, if you need to work with the long-term care plans, how long would those processes take? And I guess they can go concurrently, right, while you wait.
yeah, so it's interesting, being speaking through a lens where we're private pay focused. And when I say private pay focused, just meaning that's the core of our marketing effort, and the majority of our revenue is private pay individuals. So as a result of that, we have one less restriction, because all of us are going to have to go through some of the similar hoops, right? So the first hoop is finding a location and negotiating the lease or purchasing the building or whatever that case might be. And then once we get through that hoop, usually there's going to be a construction element to it, or whether, sometimes major, sometimes minor on the renovation side. And then there's the permitting hoops and, all those other hoops that kind of come along with that. And then there's the licensing hoop, you know, and then, you know, for someone like us, like after the licensing hoop, like we're guns blazing, like ready to roll, and you know, and we're focusing on our core market. You know, at that same time, we're able to apply for, like, say our VA or some of these other things, but because they're not our core focus, we're not depending on getting those contracts and securing those contracts tomorrow for the sake of keeping our business alive. But we are applying for it, so it's like less pressure at that point, because really our biggest hoop to get through was licensing. Some states you'll go through and there is no licensing. So really you're just jumping through, finding a location, and, you know, going through construction and then getting out there and starting to market. Other states, licensing might even be a bigger deal, you know, and might cause more delays there, or permitting could be, more strict, and that might cause delays. You know, and then when it comes to the contracting and credentialing part with the VA and Medicaid, like for instance, just to give you an example, in the state of Florida, my location south of us in Port Charlotte, and the one here in Sarasota, Port Charlotte, it took me 18 months for us to get VA credentialed. In the Sarasota location, it took us about 6 months. So just to, you know,
Wow.
actually it was about, I think it was 6 months is when we received our like approval that we were, like, you know, our application was approved, and it was actually, yeah, take it back. It was actually 9 months before we received the official, like the credentialing package, which allowed us to finally bill for those services. So,
Wow.
you know, so like the location to the south was 18 months. Now, here's what's interesting is the reason why that one was 18 months is because the credentialing office that oversees that location is in a different, you know, it's in a different a different program, or a different location in the state of Florida actually approves the credentialing for that location. And the one up here, we were informed that typically is a little faster. So the one was 18 months, the other one was about 9. So that just gives you an idea of the VA. Now, Medicaid depends on the state. Some states are, you know, set up where you would bill for Medicaid directly through the state. And so you're getting a contract, or going through and applying for Medicaid through the, you know, through the state, and you know, that process sometimes could be closed, you know, to new providers, depending on how many providers are part of it, you know. And then there's other states that Medicaid, the state itself has, you know, instituted managed care organizations, which are like essentially insurance companies that kind of play the middleman between the state and the provider. And so in that case, like in the state of Florida, where we have MCOs, we actually have to apply for our Medicaid license, which is approved through the state. And then we have to go get credentialed with a variety of different Medicare or managed care organizations, or MCOs, to get credentialed so we can actually bill for services.
Right. Yeah, it's a long process.
It is a long process. I don't know of an easy answer, other than like, I know when we think about the franchising side of what we do, you know, we always are, you know, estimating it's anywhere between 12 to 18 months, you know.
Got it. Got it. Great.
Yeah. And you know, when it comes to, I think you said long-term care insurance, you know, that's kind of more in the private pay world. So typically with the long-term care insurance company, you know, like say we have a member that starts with us, they have a long-term care insurance policy, and that it pays for adult day. Typically when they come to us, you know, we don't really have to do much other than us being licensed and insured. Those are really the two main qualifications that we need to have in order to receive benefits from that long-term care insurance company. So, you know, in that case, it's really a matter of the family or the representative kind of, you know, working with their long-term care insurance company, and, you know, saying, hey, we want to use these services, here's their information. And then us kind of awaiting an email or a fax or some sort of notification from them, where we, you know, they're going to be asking us for a list of some things. And then once we send it back to them, the credentialing process for that's pretty fast. So, you know, there's not much of a you know, kind of a waiting or a delay there. You know, sometimes, you know, and in most cases, when we work with long-term care insurance companies, you know, 99% of the time, we're billing the families. The families are paying us directly, and we're maybe facilitating on the back end, providing documentation, whether it's through invoices or progress notes or care notes, and sending those into the insurance company. So there's still a responsibility for us to help the family, receive their funds. But in the majority of cases, our rule is that we bill the families directly, and they get reimbursed by the long-term care insurance company.
Got it. So you consider those private pay. That's interesting. Okay.
Yep. So, all great questions, but it's definitely not an easy road. And I've been through it multiple times between assisted living, home care, adult day now, and there's definitely other industries that you can get into that probably have a quicker pathway. But obviously we're all here because we really care about helping people, and usually people that are in this group that want to pursue this, it's a calling, it's a passion. There was some maybe family involved that was part of maybe that care journey that inspired this, and so I know it can be a little bit more of a harder, challenging path up front, but obviously there's a lot of rewards, and just being able to help people in the way we do is extremely rewarding. So
Thank you so much.
thanks, Jessica. Appreciate you being here. And we'll go on to Brittany. Brittany Cole, are you on?
Hey, yeah, I'm glad I'm joined last minute here. Thanks for having me.
Absolutely. Well, I'm glad you're here, and yeah, definitely feel free to go ahead and share your question. And I know you wrote it in the chat box, but go ahead and share for all of us, and we'll kind of dive into it together.
Yeah, it's kind of just a hodgepodge of questions, but I have a church it's a brand new church facility, and they have multiple classrooms, brand new kitchen, multiple bathrooms. So it's actually an ideal location for me to try to operate out of. And I know they're pretty willing to work with me as far as the lease goes, knowing that I'm just starting up. I guess my question was kind of just for the group. Has anyone else ever started up their business in this route, like operating out of a church?
Yeah, for sure. Actually, a good friend of mine, his name is Gabriel. I think his last name was Corridor, like Gabe, like Corredor, something like that. And he has an adult day center called, I think it's Evergreen Adult Day, and he started that way. He found a church, he partnered with them. He rents their space out for a certain period of time throughout the day. Has the benefit of utilizing a lot of their incredible facilities that are already there. Right, they have a big open area that
Right.
his adult day is operating out of, and then he has the benefit of utilizing their kitchen and stuff like that. And it's been a great partnership, because for the church it's a little bit of outreach and community awareness, and obviously, like, the work he is doing is fantastic for the community, and for him it really allowed him to get a start at a lower kind of like and reduce his startup costs, and kind of get his feet wet and start building a name for himself, and start kind of having a list of people, and having a kind of a client or a member contact list that when he decides to make that leap maybe to his own space when it makes sense, he can do that, and he'll already have people that are enrolled and people that are already a part of it. So definitely doable. I think if people are on a budget, it's a great way to go. And I think obviously each partnership is going to depend heavily on the church's ability to be flexible and what they allow and don't allow for you to do. Because certain states might have certain requirements regarding adult day as far as the licensing is concerned, that may require maybe secure areas, or maybe there's elements to the inspection process from a licensing standpoint that might have to happen. And making sure the church is on board and is okay with, if you had to make some changes and maybe you had to be the one to, like, incur the cost of that, like, are you allowed, like, will they allow you to make those changes, to modify the space in a way that would allow you to be a licensed adult day center?
Right. Yeah, the problem that I was coming in before in Virginia, I'm not sure if it's the same in every state, was finding enough bathroom. In Virginia, they require you to have a certain number of stalls per participant, and I just didn't feel like it was going to be profitable for me to have, somewhere that only had one bathroom if, you know, if they weren't gonna, um,
Was it? Do you know what the ratio was in your state?
I think it's one bathroom for every 10 participants, if I remember correctly. It's been a little while to me. I think it's 1 per 10.
And in the space you were looking at, the church, did they only have just one single bathroom?
No, that's why I was
Okay.
saying I really liked it. They have men and
Multiple
women's
bathrooms, yeah.
restrooms, and they
Yep.
have multiple stalls in each one. So it would allow for me to have more participants. Because if I was limited to a space that only had one bathroom, well, then I can only have 10 participants.
No, for sure. Yeah. And that is that is an issue. And what's interesting is just for everyone on the call too, sometimes, you're dealing there's when it comes to bathrooms or occupancy, you have two parties at play here. Sometimes it could be the zoning, the way that the zoning is classifying the space, and what the zoning laws might be for that classification might have a requirement about how many bathrooms you need to have, per number of people that can be allowed into the building. And then you have the licensing side for the adult day side, and they may have their own requirement. Sometimes it might be tied to a bathroom. Other times it might be tied to the square footage of the usable space in that area that may help them come up with capacity. And then there's the other thing that kind of affects capacity is potentially ingress, egress. So when they think about the fire safety plan, the number of exits and how far away the exits are from certain areas, and sometimes the number of exits that might be in a building may also have an effect on the allowable occupancy. So sometimes fire department, zoning, and licensing can all play a role in limiting or increasing the capacity.
Right. And is there I do plan to operate off the Medicaid developmental disability waiver.
Yep.
Is there a certain amount of participants that I should start with in order to make sure that my business is going to be profitable? Like that you've noticed, or I know you said you're mainly private pay, but and you're obviously not in the same state, but
Yeah, so the differences too is just something else that I've learned over the years is that every state's different when it comes to their Medicaid reimbursement. So their Medicaid reimbursement for seniors versus maybe intellectual disabled might be two different rates. And so you might I was it may have been Virginia. Have you looked into what the reimbursement rates are, Brittany, for Virginia?
yes, I have.
And and is it different for seniors versus the IDD population?
Well, I thought you meant the different tiers. I know that it's like 1 through 4, and the first tier is the lowest, and then it gradually gets higher until you get up to 4. Like by a
Is that for the intellectual disabled, or is that for seniors?
Yeah, the intellectually disabled. That's really the only population that I'm hoping to work with.
Okay, gotcha.
Yeah.
So in my experience, there's a lot of times certain states, depending on how it's set up, the intellectual disabled benefits or Medicaid reimbursement can be higher, and then say your senior population for the age 65 and up. Now, along with that, what may come is you have to have higher staffing to member ratios, where in senior, like I'm not saying this is how it is in Virginia or whatnot, but you might be say like 1 to 3 or 1 to 2, for for the IDD, population, so kind of you're focused on young adult with disabilities versus maybe in the senior space, the state may have a requirement that's like 1 to 7 or 1 to 6 for seniors. And so, every state's a little bit different. And so, again, this kind of comes down to, I always tell people when they're thinking about the type of adult day center that they want to open, it's always very important for anyone on this call, if you're in that discovery phase, you have to ask yourself the question, what type of adult day center do I want to open? And, one of them is, do I want to work with young adults that have disabilities, or do I want to work with seniors? As far as like my main focus. Now, we are primarily focused on the senior population, but we also care for those that might be young adults. Um, and that's okay, but our focus is seniors, so we don't have a ton of young adults, but it doesn't mean that we don't allow younger adults to attend our program. It's just that our focus, our programming, everything we do is catering to the senior population. So, one, identifying who you're serving. Two, are you going to, is your goal to primarily focus on the private pay population or on the Medicaid side? And then, do you want to be a nonprofit or for profit? And then lastly, is the idea behind it to be more of a social model versus a medical model? So, picking each of those categories, kind of identifying and circling, hey, who do I want to be? What type of adult day center do I want to open? Kind of honing in on that will help you make better decisions when it comes to getting contracted, choosing a space, marketing, and getting that information out there.
Okay, thank you.
Absolutely. All right. Well, thanks for being here, Brittany. Appreciate you joining us. And Larice.
Hi, Kris. So I actually have quite a few questions.
Well, I'm slowly running out of time, so I'll try to
No,
get to
it's
maybe one
okay.
or two, and then
You answer most of them.
Okay.
I guess my biggest thing is because we've already been through the finding a space, getting it renovated, up and running, going through the licensing. Now we're in the contracting. I know you mentioned that your biggest focus was private paying. Do you offer things like meals and stuff? And if so, is that included in your rate at that $100 rate?
Yeah, so being that we're private pay focused, I would say that we typically are, we're having to kind of go above and beyond in a lot of different ways,
Mhm.
for our members, so because at the end of the day, these are families that are choosing to spend money out of their own pocket, whether it's them managing their loved ones' funds. So like if you got an adult child taking care of maybe their mom or dad, they
Mhm.
may not be writing the check themselves, but they're managing mom's funds and trying to be a good steward of that. And so they're, being conscientious. And so we have to make the environment, a place that there's a lot of value for the amount of money that they're going to spend with us, so that their loved one enjoys it, but also that like, our services are a little more elevated. So, we include breakfast, we have lunch, we have an afternoon snack. It is, like chef prepared in-house, for all of our members. We have live music every single day at 1 o'clock. We have a very robust activity program. So we're constantly doing something every 30 minutes. We're rolling into a different activity. So there's a lot of stuff going on to, keep our members engaged, keep them happy, to really kind of curate this experience for them, to kind of attract that private pay audience, and then same thing, to attract that audience. Like we also have a lot of marketing efforts, and we have, a marketing director out there in the community, educating the community, and knocking on doors and working with case managers and referral partners and neurologists to make people aware in the community that we exist and that we're here and who we serve.
Okay. So when you mentioned marketing, you said you have a marketing manager. So like do they do like the door-to-door process and things like that? Like what's some of your biggest things that you notice like it's always a good turnaround when this happens for promotional wise?
Yeah, so for us, being senior focused, so we're caring for a lot of people with dementia, Parkinson's, Alzheimer's.
Mm-hmm.
Kind of a staple for us is neurologists who maybe cater to the population of people that are suffering from, say, Alzheimer's or some form of dementia. Like us, going in there, we'll do a lunch and learn. So we'll come in there, we'll have all of our literature and all of our information, and we'll provide lunch to the entire office and get everyone's undivided attention, and kind of have a 30-minute like educational time frame where we can talk about what we do, ask questions, they can ask questions, and build a relationship with that doctor's office. Same thing with Medicare home health companies that are providing PT and OT into people's homes in the morning time. A lot of times once a week they'll have what they call a case conference, where they might get their entire organization together, all the physical and occupational therapists all at one time, and we might have an opportunity where we can provide breakfast and come in and speak for maybe 10 minutes about our services. Skilled nursing facilities or hospital rehabs that have case management departments, same thing. We're trying to maybe provide a lunch or find a way to get connected with the discharge planners, social workers, case managers, who are all making influential recommendations to families when they're trying to find care for their loved one.
Okay. When you are doing your billing, do you have like because we have a system in place called Care Center. Do you use a system like that to track attendance and billing, or is that all just done by?
Yeah, we use a company called Story Care, so Storii.
I did a demo with them.
Yeah, I love Story Care. They're fantastic. They are a little more expensive, but Story Care was built from the ground up specifically for adult day. A lot of other software organizations were built for, say, home care or skilled nursing
Nursing.
facilities or some other type of long-term care, and then they were like, oh, let's add these components and sell it to adult day. So sometimes when you're kind of exploring the software services that exist, you might get a software that was primarily built for home care, but it has an adult day component, and so maybe it doesn't have all the feature rich stuff that you would like for your adult day center to have when it comes to a software, but it might be less expensive than, say, something like StoryCare, which might be a little bit more expensive. But StoryCare has an incredible customer service support team that really like helps make the onboarding process a lot easier and stuff like that. So we use them. Before we had them, we used a company called My Adult Daycare, and there's probably like 6 or 7 of them that are consistently at like the trade show, like the NADSA one coming up. So they definitely do exist. I think I saw another one that had recently started. I think it's called like Seniorversity or something like that. But I know they recently started on the kind of focusing on the adult day space. But StoryCare is definitely like the one built on the ground up or from the ground up specifically for adult daycare, and then been at it for a long time. So there's a lot of customization when it comes to the billing side and using it as a way to track attendance, but also to submit for billing.
Okay. How long did it take you to kind of see your first profit from the company after getting it up and running and getting the clients in there?
Yeah, so in our Port Charlotte location, which is the greatest example of like opening, getting through that stabilization period and finally becoming profitable. And we basically, it took us about 12 months, like 9 to 12 months to kind of stabilize where I wasn't having to come out of pocket every month to like cover costs, and it was kind of we were breaking even, and then it took about 18 to 24 months to finally turn a profit.
Okay. Sounds good. Thank you,
Yeah,
Kris. You answered a lot of my questions, well, all of them. So I appreciate that. Thank you.
absolutely. I'm glad you could be here. I figured for the sake of time, I know we're getting close. If we got maybe one more person, let's see here. I was gonna kind of go through the questions and see who else might have a question. I think the next one up, I had Ruby. I don't know if you had a question. My questions are, oh, Ruby said her questions are being answered. All right, well, that's great. I'm glad we were able to help out there, Ruby. Let's see here. I don't know if, yeah, it looks like it's just Brittany and Larice that were throwing them in at the end there. So if anyone else has a question, they want to just unmute their mic and, we can do one final question here. Happy to help. So.
Hi, my name is Sean. I'm sorry I'm late. You might have answered this question already, but I have a adult daycare in Milwaukee, Wisconsin. I'm in the process of getting it certified by the state. But my question was, do you have any good suggestions where I can start looking for some clients now before I open in November?
Sure. So Sean, did you buy an existing adult day center and now you're going through relicensing or the change of ownership, or did you build a new one from scratch and you're going through the initial licensing process?
I did it from scratch.
Okay, gotcha. And are you primarily focused on the Medicaid population or private pay, or have you decided to kind of like, and are you senior focused or young adult focused?
Senior.
Okay, so senior
Senior folks.
focused. And
Hmm.
then is your plan, are you primarily kind of catering to Medicaid or your private pay population?
More towards the Medicaid. I do have a couple of people that reached out to me for private pay, and even some veterans, which I guess that I didn't know veterans qualified for
Yeah,
daycare.
the veteran program is great. It's so the VA does pay for it as well as Medicaid. The veteran program has a great reimbursement rate, and so when you get your license, you definitely want to apply for both Medicaid and VA, because the veteran program, it's a great program. A lot of times, veterans who get approved for services like Adult Day, they could be a little bit younger and maybe physically or better physical condition, and it's great because you get a group of guys that are veterans, and you have this incredible camaraderie that can be created for your VA folks. So we love having our veterans. We do a lot for our veterans to kind of support them and to also be a hub and a sort a resource for our veterans. And that's a great program. It pays well, and it really serves the VA, the veterans very well. So the other thing is on the Medicaid side, when you think about, earlier I was talking about some of the marketing efforts. I don't know if it was Brittany or Larice when I was kind of sharing some of the marketing that we do. Again, the information I had shared at the time for anyone else on this call was kind of catering more so towards that private pay audience, where we're going into neurologist offices, we're going into skilled nursing rehab, Medicare home health companies, and sharing educational lunch and learns, breakfasts, kind of sharing about what we do and how we can serve them. If I was Medicaid focused though, my approach would be a little bit different. So for those who are Medicaid focused, then you're really going to want to so if you're in a state like say Florida, we have managed care organizations or MCOs. And I don't know if do you know, Sean, in Wisconsin, do you bill the state directly for Medicaid, or do they have insurance providers that are called managed care organizations that are kind of like the middlemen between the state Medicaid program and the provider? Do you know which one you have?
I think they have a middleman because
Okay.
I kind of know a little bit about it from working in CBRF for 13
Okay.
years, and it was
Yep.
definitely through a middleman that
So
the
so so
clients came
so
in.
Yeah, so you probably had these different insurance companies. Like I know in Florida, in the area we're in, like each region has a different insurance companies that are in the region. So we might have like five
Mhm.
or six different insurance companies. Those insurance companies are like they're called, MCOs or managed care organizations. And so what happens is we go get apply for our Medicaid license, we get approved to be a Medicaid provider, and then we go back to each of these insurance companies and we get credentialed with each one. And as we go through the credentialing process, we're negotiating rates with them, and each one might be a little bit different. Some MCOs are a little more flexible and they're more willing to negotiate rates that are more favorable for us. Others are just so big that they're like, look, this is what we offer, take it or leave it. Like there is no room for negotiation. So
Okay.
if you're in a state like that, those insurance companies are going to have case managers that are working behind the scenes. A lot of those case managers are working remotely. Every state again is going to be a little bit different, but at least in the state of Florida, a lot of our case managers are maybe working from home, working remotely, working out of their car. They're out in the field visiting with clients that are part of that insurance company and kind of assessing needs, dealing, with changing needs of individuals. And so building relationships with those case managers are really going to be important because they're the ones that are going to feed you referrals. So if you're Medicaid focused, then building relationships with your MCOs and those case managers that are managing all those patients is going to be the area that you would want to put a lot of your efforts when it comes to marketing it to.
Okay.
And so right now, and sometimes those people might be visible. Sometimes they're a little bit behind the scenes because again, they're in their cars on the road, working from home, so you may not have an office where you can go visit them. But through the credentialing process where you're applying for to be a provider for that insurance company, you might be able to get to know the person there, and maybe they can introduce you to the case management department, and you can meet someone in there, connect with them, kind of get to know them, build a relationship with them. And the more you build those relationships with them, the more and more referrals you're going to start to get from those case managers.
Thank you.
Yeah, absolutely. Well, hey, we had a wide diversity of questions, which was fantastic. I love it. So I'm so glad that everyone was here today that could join. Appreciate you guys. Just for those that, if you guys have any other questions, if we do this call, if this is your first time on this call, we do this call on the second Wednesday of every month. So you'll definitely get a notification about it. You can always come join. Mary's been with us joining these calls for over 2 years now, which is amazing. These are free, completely free. If you have any specific questions related to your individual needs and you want to dive deeper into it, we do have some coaching call options. So if you go to adcpro.com, you can go on there, see about the different coaching calls. We do consulting, not a lot, but for maybe a handful of people. I can't really work with any more than 2 at any given time. I know we have 1 space available now. If you're looking to do a market analysis of a specific location and you're just trying to see, hey, is the density of the population in my area sufficient to support the size of location, and you kind of want to have reassurance of that. We also do, those as well. We have a Facebook group you can join. We'll put this information out on YouTube. This video will go out there as well. And so if you haven't already, make sure you subscribe to that. And if you have any interest in getting a copy of the book I wrote, The Great Care Crisis, it's specifically about the adult day industry and the future of long-term care, and why I believe the future of long-term care is adult day. And so I appreciate you guys all for joining me today. Thank you for being here. For those that are coming to the NADSA conference here in October, I look forward to maybe seeing you there. And if you haven't already, or if you're able to and you haven't gotten tickets, I know there's still tickets available to join the NADSA conference. So would love to meet some of you guys in person if you can be there. But thank you so much for joining me on this call, and we guys will see you on the next